You've got questions, we've got answers.
And I think that makes your pathway to university a lot easier.
The brain,
especially the first year if you pick the right subjects in year 11 and 12.
Information.
Here, and those signals run down through the spine.
Here in our studio, we'll be bringing you the answer to these questions and more. Join us for Informate. Assalamu alaikum and welcome to another edition of Informate. Today we'll be talking about the preventative tips and measures you can take to reduce your risk of being diagnosed with cancer. Recently, the World Cancer Research Fund announced that now cancer is the #1 cause of death worldwide, with the 5 most common cancers being lung, breast, colorectal, prostate and stomach. Although there are some things that can't be controlled about cancer, decades of research have clearly shown that by living a healthy life, people can reduce the risk of developing the disease. Some of the risk factors for cancer are alcohol, tobacco use, an unhealthy diet, lack of physical activity, and as always, it's all about prevention rather than treatment. To help us answer this and other questions, we are joined here again by Surad, nutritionist, author and speaker, and founding director of the Nutrition and Wellbeing Clinic, and Dr. John Cummins, a specialist consultant physician and the principal and medical director of executive medicine. Thank you both for joining us here again today. Appreciate you coming back.
It's a pleasure.
Absolute pleasure.
Now, we wanted to talk about cancer in this particular episode. Now, John, do you mind giving us a definition about what is cancer?
Cancer basically is an uncontrolled growth of cells. So our body's always forming cells. You know, if you think that our hair falls out, new hair replaces it, as a good example, skin cells. And usually in a healthy person, the body has some braking mechanisms, almost like levers or handbrakes, to stop a cell from to keep on reproducing. Yep. So unfortunately, when through a variety of causes, and there's numerous, for example, certain viruses, radiation, lifestyle things, perhaps genetic risk factors, then stop that handbrake mechanism. The cell keeps growing and growing. So why does that lead to a problem? The problem is then that if you've got an organ, for example, say it's a kidney that's this size, and the cancer starts infiltrating normal tissue, eventually it's going to overtake that whole organ, and you're not going to have enough organ tissue to do the normal function. In addition, some cancers can then spread. They can spread locally or get into the blood vessels, as an example, spread to distant sites and then
travel
replace
through the
other
blood.
tissues.
Yeah.
And I must say, Gaz, that we've spoken previously about people's fear of stroke and heart disease, but there's probably nothing that strikes as much fear into someone than having a diagnosis of cancer.
Absolutely. Yeah. So what you're saying is it's the uncontrollable growth, but there are many potential initiators, starters of cancer that can promote the progression of cancer. Yeah. So it's not just the one simple disease that people tend to think it is.
Yeah, it's a multi-step process.
Yeah. Is there any early detection methods that people can find out if they've got cancer?
There are. I mean, it's really interesting if you look at the. Look, essentially, people go to doctors because they're unwell and have symptoms of a cancer, and by then, unfortunately, the odds of survival aren't as good. And I'll give you one statistic I keep in my head. If you have symptoms of a bowel cancer, so when the bowel cancer gets big enough to stop the bowel function, it'll block it. Wow. So you'll get pain,
block up your whole colon.
Yes, or you may get blood, because it's got a blood vessel that's bleeding in the cancer. By the time you've got symptoms, typically your 2-year survival is about 50%. So half the people are dead within 2 years. But in terms of screening, from a medical perspective, we have some great screening programs. For example, looking at doing a stool test for hidden blood is a really good screening program for bowel cancer. And colonoscopy. All colon cancers begin with a polyp, we believe. And if you can take the polyp out, that person will never get a bowel cancer. So that's catching it very, very early. Pap smears or cervical smears, for example, catches it very early. But other things, for example, you can do a skin check for melanomas, with the incidence of which is rising. So that's a malignant skin cancer. It can be highly fatal. We've got mammograms and ultrasounds. We've got prostate blood tests. That there's a test called a PSA that can be useful for cancer. But often it's just a physical examination too. The number of times I've detected cancer in people that came in for another reason and had no idea that they had a thyroid cancer sitting there or a mass in their pelvis.
Hence the importance of a thorough examination.
Correct, correct, yeah.
But so you can pick it up a little bit earlier.
Yes, yeah.
And it would be true to say, wouldn't it, John, that we've become a lot better at detecting cancers earlier now and a lot better at treating cancers.
Absolutely.
But we're no better really at preventing them.
Wow.
No, and in fact probably getting worse. I mean, I think people are dying somewhat less from cancer overall. We're really good at some cancers and not others yet. For example, brain cancers we need to find more out about. But I think that as the world is struggling across all cultures and all countries with obesity as an example and eating highly processed foods, I think that aspect of prevention is really going backwards.
Yeah.
Yes.
Okay. Now the World Cancer Research Fund, it provides some guidelines on the prevention of cancer. So do you mind elaborating more about what they are, what their role is?
Well, the World Cancer Research Fund, and I'll just hold up one of their publications from 2007, actually started off in the year 2000. They are a network of cancer societies around the world, and their whole goal is to prevent cancer. So they pay for a lot of research to be done, and then they pull together all the leading scientists around the world who research cancer, and they get them to look at all the studies and to make conclusions about what's linked to cancer, what prevents cancer, what can reduce your risk, and then come up with recommendations for health professionals and for the public to use. So they produce these documents. So as you can see, it's a pretty thick book.
Yeah, it is.
And now what they're doing, they're actually updating this book every year, so they no longer print it, but they come up with very practical recommendations that you and I can apply to our everyday life, and they're the things we're going to talk about today to reduce our risk of cancer.
So even with cancer, let's touch maybe on age demographics, John, if you don't mind. Is cancer limited to old people, like say hypertension was in our last episode?
Absolutely not. You have infants that are born with cancer, that's been described, through just within a few hours after birth they're born with it. There are some cancers that appear pretty much just in 2-year-olds. Some of the kidney cancers, for example, are very specific. Testicular cancer commonly occurs from teenagehood to usually, but throughout the life, but it drops in later late 30s. Lymphoma can attack at any different age group. Melanoma is known to kill young people, so it's absolutely not an old person's disease. Having said that, I mean, the older you are, the more likely you are to get a cancer. But cancers do occur through all age groups.
Yeah. So in terms of getting older, because we've got so many more people getting older now, we are uncovering more and more cancers. The key thing is that 30 to 40% of all these cancers actually could be prevented. That's what the World Cancer Research Fund says.
And I think that's astounding. And I would think 30%. That most people in the community would not know that.
No.
That 30 to 40% of all cancers are preventable. That's astounding.
And that's in general, on average. But some cancers like bowel cancer, they say that up to 80% are totally preventable by the way we eat, the way we live. So people have a great deal more control within their own life than they realise.
That's amazing. Now, the World Cancer Research Fund, some of the guidelines that we'd like to touch on today, I mean, we've got body mass that we'd like to get covered, you know, physical activity, how important is that in preventing cancer? And high-calorie food and drinks, I think that's not something that many people really know about, that it promotes cancer or
linked to cancer.
So with body mass, I mean, we all knew that, you know, if you're overweight, you'd have issues maybe with your heart problems or plumbing problems, as we were talking about. But over your weight, how is that related to cancer? John?
Well, I think, it's multifactorial. What I mean is that it's not necessarily alone just the body weight. It's probably the processes by which people became heavier through eating bad food, for not exercising and things like that. So it's not an easy question to answer, but I think the simplest thing is probably if I could show you something about body mass index so people can check their own to see if they're overweight. But the message being that no matter how you get there, if you can keep yourself lean, you're probably protecting yourself to a large extent.
Yeah, and even if you've got a cancer, or you've had a cancer, to reduce your risk of recurrence, the leaner you are, the lower the risk of recurrence. Isn't that amazing?
That is.
And so, Gaz, body mass index is a mathematical calculation which can be a bit complex. It's your height in metres squared divided into your weight in kilos. So 80 kilos divided by 1.75 metres squared would give the BMI. But there's a simpler way. If you step around, anyone can do this at home. So we just basically get a cloth tape measure or any sort of, so a builder could do this on a work site, for example, but they essentially just put the tape measure, and the builder wouldn't be wearing the microphone, but that's okay, around about the belly button and just see how many centimetres. So if you turn around there, Gaz, under 95 centimetres for a male is said to be fairly good, and under 80 centimetres for a female. Gaz, you're nice and lean, you're nice and healthy, 90 centimetres. So well done from that viewpoint.
Less to worry about at night when I'm trying to go to sleep if I don't get caught up.
So you know, unless you're, just to keep it simple, for the vast majority of people, a simple waist measurement will tell you whether you're carrying excess weight or not.
Yeah. But the whole thing with body fat and cancer is that this is something that, say, 10, 15 years ago, we did not appreciate was such a strong risk factor for driving cancer. Now it's appreciated to be the main risk factor for cancer.
Really? Is just your weight?
So in fact, it comes up under the World Cancer Research Fund guidelines as the #1 thing to control your body fat, because it is a strong driver. And as John says, it may be because what gets you there to be so terribly overweight, the kind of foods, the kind of lifestyle, are the things that are causing.
So it all rolls in together and contributes together. But John, as a trend, is obesity on the rise?
Oh, absolutely. I mean, look, the every single country, whether you're Arabic or Anglo-Saxon or Asian, every continent, every demographic, every whether you're underdeveloped, developed or developing, it doesn't matter. The rate of rise of obesity in the last 20 years has been astounding. Truly astounding.
And in Australia, for example, 63% of our population are either overweight or obese.
Wow.
And if you look at kids,
that's over half.
it's like 1 in 4. At least. At least.
So it's a trend that has to...
And it's not just puppy fat. It's actually predicting that they will become overweight adults as well.
That's astounding. So just by controlling your body mass, it's the #1 thing that could reduce your risk of contracting cancer.
Just be lean, be thin.
Just be lean, as lean as you can, through natural, healthy lifestyle methods, not by going on crazy fad diets that don't work, we all know that, and actually make you put on more weight afterwards.
So just stick to the natural methods of reducing your weight.
Yes.
Now, exercise as well. So exercising, it'll generally help you reduce your weight, which I'm guessing in turn reduces your risk of cancer, but exercise directly. So is there some sort of correlation between exercising?
Yeah, that's a really good question. And they're looking at why on earth or how on earth can being physically active lower your cancer risk. We've known for some time that, for example, John's getting into it.
Just doing a little bit of exercise
for colorectal cancer, so of your bowel, that people who walk about 60 minutes per day, so who clock up 60 minutes of movement per day, are at significantly reduced risk of bowel cancer. And we used to think that just applied to colon cancer because, as we all know, when you move more, it helps your bowels work better. Everyone knows who's been in hospital, you're in that bed, you can't move, you can't go to the toilet, it's terrible. But as soon as you start mobilising, that really facilitates. And that's one mechanism whereby it might help. But we now know it's also linked to breast cancer. So if you want to reduce your risk of breast cancer, you should also walk. Walking 60 minutes per day will significantly lower your risk of breast cancer as well. So we think it may have something to do with how it regulates your blood sugar level and a hormone that then regulates your blood sugar, which is called insulin. Because we know that having high levels of insulin and the way most people eat, refined processed foods, will mean their sugar goes up quickly, and then the insulin, the hormone that chases the sugar, goes up quickly, and so they're spiking insulin all throughout the day. Spiking high levels of insulin regularly has strongly been linked with promoting cancer cell growth.
So all they've got to do is just walk. They don't need to go out and be a marathon trainer or run any marathons.
Don't have to join a gym, just a good brisk walk. Perhaps 2 sessions of 30 minutes,
you could
4
break
sessions of 15 minutes.
In fact, much of the guidance now is to try and make movement as much as possible a natural part of your life.
Okay.
It's not just, you know, you're sedentary all day, you get in the car, you drive to work, then you sit at a desk all day, you come back and you go to the gym for 1 hour. Oh, I'm really active, I go to the gym. It's not about that, it's about breaking up your day as much as possible. And in fact, even sitting for long periods is now known to be extremely harmful. The research suggests we should be getting up every 20 minutes, and that makes a big difference, doesn't it, to blood sugar level control.
So even from a health perspective, just sitting around or even exercising is benefit for your health. And there's other benefits where we were talking about hypertension as well last week. So overall for your health, exercising, is it beneficial?
Physical health, mental health, all over.
There's three great principles that I often talk about and teach for health, which is it's great nutrition, which is really simple to do, plant-based foods. It's exercise and it's managing your stress. And if you look at what I believe is the best stress management tool and the best anti-aging tool out there, it's exercise.
Wow.
So you don't need to be a, you know, elite athlete to benefit.
No. So it's just walking. That's amazing. That's what most people, I think, don't seem to know the importance of just hopping out, going for a walk down the street maybe even, rather than hopping in your car, driving 5 minutes.
Perfect. Just daily movement.
Now with food and drinks, this is something that I'm actually quite interested in, is that high calorie foods and drinks. You know, people go to the movies, get a bucket of popcorn, some soft drink. How bad are they? Or, you know, you're tired at work, you hop down to the cafe, I'll just grab a bag of chips, you know.
Yeah, look, how bad is something that's bad? It's as bad as, depending upon how much of it you have and how often you have it. So it's all about dose. Dose maketh the poison, they used to say. And it's the same thing with food. You know, so how bad are sugary drinks and sugary foods? Well, years ago we thought they were bad, but now we know that they're really bad. If I can just talk in very subjective terms. Why are they so bad? First of all, you get them in foods that are highly refined. Highly refined.
So what does that mean, Sue?
So that means they've processed, for example, a cake. That cake started off with, say, a whole grain, like whole wheat. And they've processed that to remove the bran, they remove the germ, and they're left with that middle part, which is white, refined starch. That sort of starch, that sort of carbohydrate is extremely harmful because when you eat it, the body digests it very rapidly, it raises your blood sugar very quickly, it raises your insulin very quickly. Bad for cancer, bad for diabetes, bad for weight control, bad for a million things. So refined foods have the wrong type of carbs. Not all carbs are bad.
So it's almost like eating a snake, is it?
It is. In fact, that's, yes, absolutely. In fact, what they've shown is that some of these starchy refined foods are worse than having pure sugar.
Can you give some other examples?
So whether it's cake, whether it's muffin, whether it's white bread, whether it's white rice, these foods will be rapidly digested in your body, will very rapidly raise your sugar and insulin levels. Whereas the converse is, if these foods are in their minimally refined or natural state, which will be the whole grains, whether it's bulgur wheat, whether it's freekeh, whether it's buckwheat, whether it's quinoa, or whole wheat that's unrefined, that has a completely different effect on the body. That causes a slow rise.
The low GI foods that people talk about?
Yes, so the term low GI is often bandied about. That's just a measure of how quick acting or slow acting the carbohydrates that you eat are. We want slow acting ones to give you long lasting energy and that don't cause these spikes in your sugar. So that's the starchy foods, but the sugary foods kind of got off the hook for a while because the focus was on the bad starchy carbohydrate foods. They're in the same camp. All of them are pretty high in their impact. So whether it's lollies or any confectionery or drinks in particular, really bad. Let me just show you something. This is something I went to buy. I had to go and buy this. I went to the counter of one of the cinemas. I couldn't get a free cup, so I had to pay for it. How many teaspoons of sugar do you think, Gaz, would fit in a soft drink? So it could be any soft drink. Lemonade,
in that
cola.
large cup you're holding there, maybe 6 teaspoons, 5 or 6 teaspoons of sugar.
John, would you like to show Gaz how many? I've got the sugar in there for you. There are usually far more than people expect, and I think you might be quite surprised.
Keep going, Gaz.
Keep going.
How many, Gaz?
I don't know. Okay, if we've got 6 in there,
He knows
double it, 12
He knows
maybe.
it's going to be more now. You've given him a
Yeah,
clue.
he's given him a clue. It's more.
All right, Gaz, how
That's
many?
12 teaspoons. I don't know where to stop. 15,
Keep
20?
going. Keep going, John.
Oh.
Keep going, Gaz.
Keep
We're up to
going.
25,
25.
28,
Keep going.
30. Where do I stop? 30?
29.
More than 30.
More than 30.
34 teaspoons of sugar
34 teaspoons of sugar.
in a drink
So
container.
really, I could go up to the movie and say, can you please just sell me a cup of sugar?
And drink
all
that.
I do in
Drink
the
it.
movie is
Yeah.
drink the sugar. It's exactly
That's
the same equivalent.
amazing.
You know, if you
That
were
is
making
massive.
a drink at home, you would never stuff that much in there. But they, under the right conditions, they can dissolve that much sugar in there. And
Into
that's
a
sort
drink.
of, yeah.
That's
And, you
phenomenal.
know, people just don't know how much they're drinking because that doesn't look that big. And over 2 hours, you could easily drink that if
Yeah.
people go to cinemas. But that's actually 1.32 litres.
1.3
Yeah.
litres.
But even a smaller amount, a can of a soft drink, you've got at least 8 teaspoons of sugar. So far more hides in drinks than we think.
Yeah.
And this is not just soft drinks. This includes all sweetened drinks.
So can I ask you, this is something that I really get asked a lot about with my patients.
Orange juice. There's something I'd have
Fruit
for
juice?
breakfast.
Healthy, natural orange juice in a plastic bottle bought from the supermarket. How good is this for me?
Okay, well, that's a very good question too, because is it better, this is the question, to drink your fruit or to eat it whole?
Yeah.
And I think every parent would say, well, probably it's better to eat it whole, but you know, the kids like the juice and so on. However, when you juice, John, when you make a glass of juice, now this one I think is apple juice, but if it was orange juice, how many oranges do you think you need to make a glass of juice?
I actually made a glass of juice, 1 glass. I squeezed 4 oranges yesterday. Went to the effort
He's
of squeezing
knowledgeable.
4 orange juices thinking I'd get 2 glasses. I got 1 glass of orange juice.
You're
out of
very
it.
good, Kaz. You need a lot of fruit to make a little juice.
Yes.
So basically all you're doing is you're concentrating the sugar up, you're throwing away all that natural fibre,
Yes.
which prevents us from overeating, over-consuming. The fibre fills us up, tells us, I can't eat anymore.
Yeah.
I don't know of anyone who can eat 8 apples at once.
Yeah.
Yeah.
But I know a lot of people that can drink them in 1 minute flat because they've been juiced and the natural fibre that's meant to be consumed has been chucked out.
So should people ever have, like, if
So-
you squeeze your
Yeah.
own juice, is that
I
good
think
enough,
if you
or-
squeeze your own juice,
Yeah.
you make it fresh, try and keep as much of the pulp in there as possible. Vegetable juices, if you're watching your waistline,
Yeah.
are better. They have far less sugar content. But on the whole, the guidelines now from many of the professional societies are if you're trying to lose weight and it's not working, your kids are getting a little bit chubby, limit all sugary drinks to no more than 1 glass per day.
Yeah.
That includes your juices, does it?
Includes your juices because that can fuel weight gain just as much as any soft
So from a
drink.
cancer prevention
Yeah.
viewpoint, we should be drinking what?
We should be drinking water.
And
so.
The pure
bottled
drop.
water, filtered water, what sort of water?
Any water that's clean and pure water. Now, in some places where they add lots of things to your water, you can smell some of those chemicals like chlorine. You can get a nice filter at home and you can filter that.
Yeah.
So plain tap water that you filtered at home is perfect. You don't have to buy water. It's just an expensive way of getting someone else to filter it for you.
But that might depend which country you're in as
And
well,
it depends
I think.
which country you're
Yeah,
in. But
of
obviously,
course.
if you're travelling and it's
Yeah.
not safe, I would only ever drink from bottled water. But for the average home, plain tap water in Australia is very, very safe.
Now, the relationship between the high sugar content in these foods, is that just related to high sugar leads you to put on weight, which leads to the cancer, or is it the sugar itself that's not, or the refined sugars or flours that's going into these things?
It's probably a combination of both. The way that the science, the research findings are stacking up, they're strongly suggesting these kind of foods, sugary foods and drinks, are big drivers of excessive weight gain. Big drivers. If we could just cut those from schools, we would prevent a whole obesity epidemic.
There are also hormones like growth hormone and insulin-like growth factor. They cause cells to grow. Growth hormones causes us to grow, and one of the concerns if you take growth hormone as an anti-aging, you may develop more cancers.
Yeah.
And certainly high sugars may push out or may promote insulin-like growth factor that may directly cause cellular growth.
Because remember, every time you have something sugary or even starchy but highly refined, you push your sugar up, you push up your insulin. And insulin is linked with these excessive cell growth, and that's not good. And inflammation.
Within the body.
Wow. Now, out of all these, we've only covered 3 of these guidelines today. I mean, next time I'd love to have you guys back on. I'd love to cover the rest. I think we've got animal foods, plant foods,
really interesting stuff.
Eliminating alcohol from your diet, and we've got your dietary supplements, which I think most people don't really know about.
Yes.
We should talk about them.
Yeah, we'll definitely cover them in the next episode. Thanks very much for joining us.
It's a pleasure.
Pleasure.
Thank you.
Thank you.
Cancer is an everyday issue that 30% of us have to deal with, but as you can see from following some simple and effective lifestyle tips, you can reduce the risk of these problems occurring in the first place. Things like controlling your weight, correct diet, and abstaining from harmful products such as highly processed, high calorie and high sugar foods. And conducting regular physical activity, these are the paving stones to achieve exceptional health and longevity for any individual. Please join us next time when we look into the remaining guidelines, including plant and animal foods, dietary supplements, and eliminating alcohol. We look forward to bringing you another production from MTA International Australia Studios. Thanks very much for watching. Jazakallah and Assalamu alaikum.